The sun rises gently over the shimmering waters of Lake Victoria, painting the horizon in gold. To a visitor, the calm beauty of the lake seems almost magical. But for expectant mothers living on Sowe Paradise Island, this quiet morning glow hides a daily battle for survival. Here, giving birth is not just a natural process, it's a dangerous gamble.
Waluma ate papalambo ate genda wagundi kumwazi kayingini ate kumwazi kayingini kusasula amafuta kusasula eryato lipangisa ingino gipangisa akuvuga n'omupangisa.
Sowe Paradise, tucked within Mpata parish in Kalangalo Subcounty, Mukono South Constituency, is a home to over 500 men, women and children. The community thrives on fishing, the lake their lifeblood. Yet beyond fishing nets and wooden boats lies another reality, a life marked by limited services, harsh living conditions, and a health system that remains painfully out of reach. When labor pains begin, mothers must embark on a perilous 30 to 45-minute journey across the lake to reach the nearest health facility.
Bweri kutwala lina kutwala ku lukalu. Bw'otuuka ku lukalu era inafuna boda n'ekwongera ku malwaliro aga gavumenti oba aga private.
Zibaluma oba omwana n'alemerayo oba ekintu ky'emayiga ne kiremerayo kati ogenda okupapala simanyi kunoonya dda simanyi kukakana ng'omuntu akufiiriddeko oba olusa abaana nga bafudde bakikola nnyo
mu mazzi. During our visit, the village leadership welcomed us warmly. The LOC1 chairperson Mr. Chimera Ben and area councillor Katerega Samuel led us into the chairman's humble office, a small structure that stands as the administrative heartbeat of the island. But even they admitted that the island's needs far outweigh its capacity to respond.
Ebiseera ebisinga wano amalwaliro tuzaaliramu Eggaba. Ovuga eryato okuva wano tuuka Eggaba, manyi tubala okugenda n'okudda. Oyinza omaliriza nga liita 2 gawera. Liita 2 giba emitwalo 10-12. Kati n'ekirala waliwo erya gavumenti erituddiridde liri Kabanga. Weriri awo lizaalisa naye ate kiba kizibu nnyo ku mukazi okumujja wano ng'ali lubuto. Omutuuse wali omuteeke ku ppiki, omuvuge paka kutuuka Kabanga. Ate awo waba walako. Wana amazzi tegamukuba nnyo singa aliwa ali ku ppiki. Ebiseera ebisinga tubatwala Ggaba.
Embeera eno okutwaliza wamu tetusoose giwangalyamu kati. Lwakuba kati tuliko yaddeko okusinziira nga bwe twali. Kubanga tukyaliwo wano ababaka batera okujja wano bakansala baffe okuva ku Magombolola ne ku disitulikiti oluusi bajja ne batusaba obululu naye tubanyonnyola ebizibu bye tusanga. Nti kituufu mutwagalamu obululu nga mugenda. Naye naffe tulina okusoomozebwa okusingira ddala mu by'obulamu.
Mukazi n'asumukira mu budde obwo mu mazzi. Kati kubamu akafaananyi ng'olwo omukazi ataawa muli mu lyato omwana asaawa okusumulukuka. Katonda oyo yekka yakola ki? Yasalawo era Mutonzi waffe yasalawo Mukama n'ayamba nali nabo bamuzaalisa abamperekerako ne bayolayola omwana mu mazzi jjukira azaalidde mu mazzi.
As soon as we arrived, women gathered to share their stories.
Ekizibu tulina wano ya ddwaliro. Ekisooka oba tolina ssente tosobola genda ku ddwaliro. Wakubiri oba tolina lyato tupangisa bupangisi mutwalo 5 ogenda ku lukalu. Wokusatu tulina abasawo wano. Ne kupiima oba otandise kufuna lubuto ogenda ku lukalu. Ebizibu yaffe nga bakyala.
Olubuto lwannuma tunoonya eryato terirabika, amafuta tewali, n'owayingini naye ali walala.
Their voices cracked with emotion as they recognized the terrifying nights spent fighting waves and darkness, desperately trying to reach medical help in time. In this struggle, the community relies heavily on one man, Samuel. Their lone village health team, VHT member, Overwhelmed yet committed, he spoke passionately about the challenges he faces.
Sometimes we get a problem of transport because other people, they come to me in night time saying that they are bad off, they want to go to produce, no means. So I get that confusion and I feel that problem. One day, a certain lady came to me. It was at night. She told me that I should escort her to the hospital. I tried to escort her, reaching in the water. She started producing.
The community lacks not only healthcare services, but also adequate education and protection for young girls. Many drop out of school early and become child brides, another circle of vulnerability.
Abaana baffe tebalina masomero. Abakyala abazaala tetulina ddwaliro liri awo. Kati nze ndi wano ndi mulwadde wa puleesa naye ne bwe nkola ntya mba nsomoka busomosi mazzi. Bw'oba mu lunaku zinkubyemu emirundi 2 nina kusomoka mazzi ne ngenda kuli okufuna obuyambi. Tetulina abasawo, tetulina amasomero.
When asked about political leaders, residents expressed frustration and abandonment. They feel unheard and unseen.
Amanga tulaba mu bifo bingi nnyo president abantu ayamba abantu abavuka n'abawa boda abala n'abawa ebintu ebyenjawulo naye ffe wano nga mu bizinga tetulabangako nga president kyakutte yingiri n'aziwa abantu abali ku nnyanja era naye nkubira president waffe omulungi Museveni Kaguta kukubira omulanga abantu b'ekizinga Sowe tujjukire kubanga tukulonze kuva mwa ndoza 96 nga
tumutwagalamu obululu nga mugenda nenda ffe tulina okusoomozebwa okusingira ddala mu by'obulamu.
In pursuit of answers, we reached out to Honorable Fred Kayondo, the area member of parliament for Mukono South Constituency. He stated that he frequently raises these concerns on the floor of parliament, but the delays and bureaucratic procedures often hinder timely action.
Generally, across the whole country, not only in Mukono South, we have inadequate drugs, not only in Mukono South. I think across the country, it is the same problem we are having all over. So we are advocating to see that at least adequate drugs are supplied.
The Ministry of Health, responsible for service delivery across Uganda, acknowledges that hard to reach areas like Sowe Island face severe challenges. Ainebiona Emmanuel, the ministry spokesperson, pointed to programs meant to support remote communities, including the provision of boat ambulances.
I've not been to the island myself, but as a Ministry of Health first, our strategy mainly now is ensuring health prevention and disease prevention. And that's why we have a level of health workers known as community health extension workers and also village health teams. So a places like that Paradise Island, you said it's called Sowe Paradise Island, we rely on ensuring that we have our primary health care health workers who are the village health teams who are supposed to tell people on what to do. A health center 3 is the beginning level of care and it is about 20,000 people. That island has not reached that number.
Yet, despite these provisions on paper, no mother or health worker on Sowe Island has ever seen or benefited from a boat ambulance.
I will interest our community health department to ensure that they reach the island. Yes.
In search for further answers, we reached out to the Minister of Works and Transport, General Katumba Wamala. Shockingly, he admitted he had never heard of Sowe Paradise Island, but pledged to visit and explore solutions.
Kalangalo Subcounty.
We take it Toko from where? From Katosi? From where?
No. Me, when I went there, I used the Busavala. I used the Busavala landing site okukwata eryato okugendayo.
Not Dangena agende yegundi Mpata.
Mpata exactly. Side eyo.
bamale nange okunoonyereza ogabe bakiyita
Sowe Paradise.
Sowe Paradise.
Yes.
Sowe Paradise Island is a community full of life, resilience, and hope. But its mothers remain trapped between beauty and danger, between giving life and risking death. Their plea is simple: a healthy facility closer to home, a boat ambulance that actually exists, mosquito nets, trained personnel, a chance to give birth safely. Globally, maternal mortality ratio (MMR) was registered at 223.5 deaths per 100,000 live births in 2020. In Uganda, the maternal mortality ratio is significantly higher than the global average. According to the World Health Organization, Uganda's MMR was 284 deaths per 100,000 live births in 2020. This is a decline from 438 deaths per 100,000 live births in 2011. Uganda has made progress in reducing maternal mortality, but it still has a long way to go. The country aims to reduce its MMR to 131 per 100,000 live births by 2030. Nagweja Serena for NSTV.